Right. Thank you very much, KP. Thank you very much. My greetings to President Audrico and all members and those present here today. Special shout out to PDG Philip Chong as well as my good friend KP. And of course, thank you very much for the invitation from your club, Club Rotary Foundation Chair, PP Sunlan. Thank you very much. It's indeed my pleasure to be here. Now, my topic for today is why contribute to Rotary Foundation. Before I start, maybe can I just request either KP or PP Sunlan to just alert me if my time is up. Just give me a 5 minutes advance notice. Otherwise, I tend to overrun my time. That's a really bad thing that I have. All right. So let's go very quickly. So why contribute to Rotary Foundation? Now, Rotary Foundation is actually what we call the charitable arm of Rotary International. I think this is something that we have to be extremely clear about. The funds that you give to Rotary Foundation is not used, fellow Rotarians, in any way to pay for the expenses and the running costs of Rotary International. Rotary Foundation is a charity. It's registered in America, so it's a very well-run charity. You will see by the end of my presentation why it is so. But I just want to assure you that the Rotary International and Rotary Foundation are separate. We pay our dues to Rotary International, and the dues are used to run the business of Rotary International, including paying for RI president and RI board members for the traveling and conferences. So this is important, fellow Rotarians, because one of the main reasons that anybody would like to give to any organization is trust. So we must have complete trust in the Rotary Foundation. Now, so what is Rotary Foundation? Charitable foundation means helping people. This is an example, a limb camp in Nigeria, for example. So there are hundreds and thousands of people who are born without limbs. So Rotary come in and do good work by giving them what they really need. Let's just take a step backward and try to gather our thoughts as to what Rotary and Rotary Foundation is all about. So what is Rotary? Rotary is a global network of volunteers, people like you, me, and all the Rotarians that we know who come together, give our time and give our talent to tackle world's biggest problems, right? So the key word here is that we are a network of volunteers. This is really, really important later on. So what does Rotary sees itself doing in this world? So Rotary, and this is the official definition, so in Rotary, together we see a world where people unite, take action, so that we can create lasting change across the globe in ourselves and in our communities. I mean, this is a very good vision. The vision and mission of Rotary Foundation, again, very straightforward, to make the world a better place and doing good in the world. I think this is something that we can really be proud of what Rotary Foundation is all about. Now, before we go further, just go very quickly to explain to you the programs of Rotary Foundation. I think to understand and to be able to give to Rotary Foundation, you must understand what the foundation is doing. 3 basic programs: humanitarian grants, educational grants, and polio grants. So as you know, the Polio Plus fund is a very, very well-known fund and is supported by none other than Bill and Melinda Gates Foundation, right? So the humanitarian grants, there are basically 2 types. The global grant, as KP has mentioned just now, it tends to be a much larger international involvement, and you have involvement of partners and you have involvement of cooperating organizations, and you need to do all the proper paperwork. District grants tend to be a little bit smaller and usually done in your own district, but can also be done to help other districts. Now, global grant itself, there are various types. Our district currently support only what we call the approved global grant project. The reason is because this approved global grant project will help a large number of beneficiaries. This is opposed to the scholarship grants, in which the scholar is the only person that will benefit from the global grant, which is the minimum of $30,000 US. For an example, we receive scholars from overseas, from the US and from Japan, to do a 1-year master's program in Singapore at our local universities. This is at the Lee Kuan Yew School of Public Policy. And it will cost Rotary about $50,000 to sponsor one of these scholars. Now, the vocational training grants would benefit a group of people, anything between 5 to 10 persons. Usually they are not Rotarians. And this could be a group of teachers, could be a group of nurses, could be a group of doctors who would travel to another country to learn something more. So in our district, we are concentrating only on the approved global grant project. Now, so the number one reason fellow Rotarians to give to the Rotary Foundation, other than the trust, all right, is that we are Rotarians. This is our foundation. Let's just imagine that there is, or just think about the fact that if there is a Rotary Club or Likas Bay Foundation, and members of Likas Bay is not supporting the foundation, it doesn't really make sense, does it? Something is not right. So we should support our foundation, and I will be, by the end of my presentation, explain to you all the good things and how we can be proud of our foundation. The second thing, fellow Rotarians, that our foundation does or do very great projects. Before I explain to you about what I mean by TRF doing really good projects, let's talk about the reasons why each of us joined Rotary. I think all of you have your own reasons. But for me, I was asked to join Rotary by a fellow dentist, Dr. Oliver, who was then president-elect of my club back in 1994, 1995. So the reason I said yes to him was because I wanted to contribute through my profession. I like the idea of Rotary taking its membership from different professions and people from different vocations, and you're supposed to contribute through your vocation. So this is a perfect platform for me to contribute as far as dentistry is concerned. So this is back in 1995 at a camp, dental camp in Johor. This was another Rotary camp that we did in Myanmar in the late 1990s, and this is in 2007 in Philippines, and we've done projects in Indonesia, and we've done, of course, many projects in Nepal. Nepal was something special. Nepal was in a village in Bandipur, which is about 3 hours away from Kathmandu, and we did a series of projects over close to 7 to 8 years. Some of you may have been there with the Rotary projects, but basically what it does is that we travel to this village initially for the first 5 years every year, and subsequently every 2 years, to actually give free dental treatment. So we bring everything that you see in this picture and we run the clinic. This picture is taken back then and it's pre-pandemic, it's before COVID-19. But look at what we are wearing. We're all wearing the PPEs with the exception of the N95 mask, right? So we were very careful, we were doing it at very high standards, and trust me, we achieved a lot and I was really proud of it, right? So over the years, we could see that people were getting better, the children having better teeth, there are less extractions to do every year. People are generally getting healthier as far as their teeth are concerned. Then what happened? SARS. SARS meant that we couldn't go back to this area in Nepal for 2.5 years. And of course, we were all excited to go back when the opportunity came, and we went back in, I think, in 2005 or 2006. So what happened, fellow Rotarians? All the caries are back, all the tooth decay are back, all the dental problems are back. So what has happened is that we have not really achieved what we wanted to achieve, which is something that is sustainable, something that the community can do by itself. So this made me thinking, of course, we were very, very disappointed by the turn of events, but it's not the fault of the beneficiaries, it is the fault of people who are doing the project, which is namely me, right? So Rotary Foundation actually offered us, people like me who like to do such projects, an opportunity to improve the way that we do our projects. We should think about long-term sustainable project. Long-term sustainable means after we stop doing what we are doing, the benefit still continues. And we must be able to measure these outcomes that we want to do, regardless of whether it's the number of people that you see, number of patients that you treat, number of beneficiaries receiving the intervention. Rotary Foundation also asked us to concentrate on 7 areas of focus, and I think that has been quite well known to all of us. But more importantly, Rotary Foundation wants us to address the need that is identified by the community. Let's talk about the dental project again. They do not have any dentist or dental clinic or dental hospital in this village for many, many years, or forever, all right? They never had one. And the nearest clinic was about 2 hours away by bus and by car. Now, was that the number one requirement? Was that the number one need? How about medical? Was medical a number one need? They had a doctor that come once every week, and that was enough for the village at that time. But they had other pressing needs that we were not really addressing, like clean water, like education. So this is something that we must keep in mind when we talk about projects, and this is how Rotary Foundation helps us. So at the end of the day, we must do things that can strengthen the community so that they can address these needs on their own. All right, so this is the important thing about Rotary Foundation. Something else, I would personally say that the Rotary Foundation global grant projects are even better than humanitarian projects. Let's talk about this. Let's take this example. This is a project in Nigeria where we give a free limb. So Sulaiman here had a road traffic accident more than 15 years ago. Even though he's well qualified, he has a university degree before the accident happened, he could not work and he had no income. And of course, he couldn't afford a limb. So our limb centers provided him with a limb and even for good measure, even food. Now, what happens to Sulaiman when he goes back home? He says, thank you very much. He takes his limb, he walked out with his limb, quite happy. But once he's reached home, he will put the limb at one corner and he will go outside and continue to beg. So what we have done is we've provided charity, fellow Rotarians, but we have not solved the problem. This is another project which is fairly well known and easy to understand. This is a project in a school in Indonesia, where what we do is that we provide school-going items. We provide shoes, we provide bags, we provide textbooks, anything that will allow the child to go to school for one full year. Is this a humanitarian project? Of course it's a humanitarian project. Is this a global grant project? No, fellow Rotarians. You know why? Because if we stop here, what will happen is that what guarantee do we have that this child that you're looking at will be able to go to school the next year? And the next year? And the next year? Because they are dependent on you. Because if you stop giving, they stop going to school, right? So another project, another example, Feed the Children. Undernourished children at risk of diseases and developmental problem in Philippines. Wonderful project, and if you are there in this hall, and you will really feel good about doing what you are doing. 2,000 kids, 1,000 in the morning, 1,000 kids, 500 in the morning, 500 in the afternoon session, come together at 12:30 to have a meal. And you pay for the meal, 55 cents a meal. They have a meal every day, and the children become well-fed, and they avoid problems related to malnourishment. But what happened during the long summer break? What happened during the long Christmas break? What happened during the school holidays? The child will come back after 2 to 3 months, malnourished again. So we have not solved the problem for sure. So dentistry in a medical camp like this, I have stopped doing. KP Lu mentioned about the Oscar that I got. Unfortunately, most of the recognition was for all this work that I did. So maybe the Oscar should be taken back. All right. Now, so let's look at this picture, for example. You have a Singapore dentist in Indonesia. You have a Singapore dental assistant in Indonesia, and you have a patient who is in Indonesia. So what happened after this treatment is done? Everybody is happy. The patient says thank you. The dentist feels good about it. What if there's a problem 3 days later? Doesn't matter how many people that you help. It's those who get into the problem are the one that will count against you. Can you imagine if this is an ICAM done in a school or done in a community center? What happens if the guy goes blind 3 days later? Yes, his vision impaired to start with. What if he becomes completely blind after the procedure that was done by you? So this is something that we have to talk about. There is a major difference between charity and philanthropy. A lot of our projects are charity. Why? Charity is something short-term. Charity is something that is gut feels. Charity is something that you do spontaneously. Charity that is something that is short-term. Philanthropy, on the other hand, will address the root cause of the problem. If you look at this picture, 1961, Singapore Badminton Hall. You can see the Rotary pictures at the Rotary emblems right at the back of the picture. And you can see our past district governor, Tan Sri Tetek Eng, as well. The lady is actually the wife of our first president, Yusof bin Ishak. We could fill the whole room with polio victims. What we would have done at that time was probably to give them enough food to make sure that they can be comfortable. We give them maybe a calipers for them to walk, polio calipers. But have we addressed anything else? We should be addressing long-term problems for these children. So a Rotary Foundation grant project, for example, take into consideration these factors. You need to assess the needs, and you need to address the needs in terms of priority as identified by the beneficiary, not identified by us. We are there for short term. We need to talk to them, and we need to talk to the beneficiary, and we need to accept and plan our programs around them, not around what we have, not around ourselves. 7 areas of focus, measure outcomes, but at the end of the day, the community should be better than when you started with, not the same or worse, right? So we do great projects. Now, we fund our projects well. Why do we say that? Let's take a look at this picture. This is October 2020, 2021, from our Straits Time. The article talked about the 10 largest foundations in Singapore and how they are giving. Look at the two columns. Lee Foundation has an annual expenditure of 52.8 million. Their annual giving is 52 million. So it means that they spend $800,000 on something else, which is most of the time expenses on administrative costs. Look at the rest. If you look at number 7, for example, Shaw Foundation, 16 million and 5.2. Can you see the large gap between the two? Right? So these are two extremes. We don't know exactly what is being spent, but one of the major challenges that we have is administrative costs, administrative expenses. Lee Foundation is a giving foundation. What it means is that the board would sit back, the committees would sit back and receive requests, and they will give the money accordingly. But how many of these foundations actually run their programs? When you start to run the programs, you will realize that there are more expenses involved. But there are advantages to it, fellow Rotarians. Now, I'm fortunate to be in one of a family foundation, not my family. I'm been invited to join the board. Some of you may know Mr. Mohan Vaswani, who's our Rotarian in our club, and also his son. This is a family foundation set up by Mr. Mohan to do charity work. The foundation is about 5 years already, and all three of us are Rotarians. We understand what Rotary Foundation is doing, and we want to do better than Rotary Foundation. Trust me, the number one challenge is always expenses. We are struggling to make sure that our expenses don't exceed a certain percentage. And we do all our programs ourselves. I'm talking about this family foundation. Charity Navigator is an independent audit organization that ranks all the different foundations in America. They give 4-star rating for many, many years to Rotary Foundation. Look at the different sections in terms of governance, in terms of admin expenses, 3.8% admin expenses, 3.8%. Program expenses, 89.8%, right? So we spend a lot of our money on program. Now, so what it means is that an independent organization has rated our program expenses to be 89.8%. Rotary Foundation itself puts it at 91%. Very close. One is independent, one is internal. All right. So this difference is hardly significant. I think this is a great way of really managing donations that is received from all of us all over the world. Look at another thing. Beautiful bar chart. Look at FY 2018 and look at FY 2020. Why do I say beautiful? Any organization, including Rotary Foundation, shouldn't be spending less or much less than what they are receiving. In FY 2018, we received about 400 over million and we spend about 350 million or something. That's too much money to be in the kitty. Too much money to be in the kitty. So FY 2020 is something really good. You're spending as much as you receive. That's what we like for a very good foundation. Now, the next reason, we plan and we run our projects. I think this is the critical thing. The meaning of doing a hands-on project has changed over the years. If you want to do a hands-on project about planting trees, you get your charcoal and you get the soil, you get the samplings, you bring them all from the, everybody contribute like gotong royong kind of thing. That's the old-fashioned way of hands-on. The new types of hands-on, we'll talk about this. All right, we'll talk about our Malang project. You don't want to be a boy growing up in this village because education is not a priority. Worse still if you're a girl. Parents happily discourage their children to go to school, either encourage them to get married early or encourage them to go to work as long as they can. So in our project, we decide what goes into the bag. But more importantly, fellow Rotarians, we decide how many schools. We decide who qualifies for it. We do our own means test. In this program, we decided that any child who wants to get help from this project should not have a household income of more than $30 US. And we interview each of these beneficiaries. So this allows us to help the really students who are in need, limiting them to about 30 to 40 children per school. And this allows us to help up to 40 to 50 schools. And the last project that we had in 2019, almost 1,500 children were helped in 60 different schools across 2 districts in Indonesia. We didn't stop there. One of the big problems that we found out when we were doing this project, when we were talking to the different stakeholders, including the teachers, the parents, the number one problem that they have for education in the area is teacher absenteeism. Teacher absenteeism, I mean, for those in Singapore and maybe, of course, in Malaysia as well, what do you mean by teacher absenteeism? They don't turn up? Yes, they don't turn up. The principal tells us that the income as a teacher is not very good. As such, most teachers will work part-time during the weekends especially, and if they're too tired to turn up for school on a Monday, then they will not turn up. All right? So we did a program to empower the teachers as well, to increase the capacity to work with the local educational department to see how continuing education certificates can be recognized as part of their professional development. What about the parents? We want 25% of our beneficiaries to stop receiving the help next year. How can we do that? We can only do that if we can empower the parents to be able to afford a livelihood. So this program was selected not because what I want to do, but it's because the beneficiaries decide that this is the best way for them to be able to make a living. Now, we do not just teach them how to cook. We should teach them about food safety. We teach them about food packing. We teach them about food management. We talk to them about waste management. We even give them what is needed to start hardware, all right? Whatever hardware that they need, particular devices for them to do the cakes or to do the bread, we'll just prepare that for them and they get it for free. But on one condition, 25 of them must leave the program. Not because we don't want them, but because we want them to be independent. All right? But the last thing I think the most beautiful thing is that as planners for the project, we moved on from being just like a dirty hands-on to actually plan how to properly do the project. Anybody can pack school things in a bag, but not many people can think about how to design a project. And of course, the best thing is to bring Rotarians like you and me to actually visit the site. All right, so we are quite fortunate, quite a number of your club members have come on board with us to see the project for themselves. Why is this very important, fellow Rotarians? I'm not talking about all of us feeling very good. If you want to give shoes, fellow Rotarians, it's nice to see, or you want to see what shoes that you are replacing them with. Water project. This is in Vietnam. Whose duty is this to fetch water if the village has no water? It's always the elderly folks, right? The younger ones are out working or they are in school. What if the elderly folks are not well? What if they fall down and break their leg or their hip? Who fetches water? The girls. The number of girls not turning up in school in this particular village is very high. The reason? Have to fetch water, right? So our project put water supply to each and every home, 150 homes in this village in central Vietnam, which borders Laos. And they have to use the same outlet for the kitchen, for the farm, and for the toilet, right? We didn't stop there, fellow Rotarians. We talk about what else is needed, and the beneficiaries, the village community leaders, actually brought us on a tour of the preschool areas where they had 2 classes of 60 students. And they informed us that they had a very high absenteeism because of the fact that there's no water and no toilet in the school itself. So other than helping the villagers, that's what we wanted to do to start with. We expanded the project to actually include the preschool. And it's not about water. We talk about teaching them how to wash hands. We're teaching them how to save water so that from young they begin to understand the value of limited resources. We are all different professionals, all right? There are dentists, there are travel agents in this picture, there's a banker in this picture, but we all come together and share our thoughts and see how we can do better for the community. And this was one of the very nice results that we had, and also pushed forward by the village community leaders. Each house had a water meter. Why? Because even though we've done all the projects, we wanted to make sure that we can monitor the water use, that it is not being abused. But the village head themselves told us that a water meter is important, sir. Why? Because there will be abuse. In the middle of the night, they predicted that people will come in on their motorbike, and collect water from the houses for a fee. So what happens in this project for Rotarians is that every household is entitled to use a certain amount of water, very, very generous. It's not free. There's a minimum payment of about $1 per head. But if they exceed that amount of water that they are entitled to, the water meter will ensure that the water is cut off. Why? Even though they have more money to pay, or if they want to pay more money, the money is theirs, but the resources are limited, and it has to be shared fairly. So another project, if you see a young person who needs a limb, all right, if you want to do 1,000 of these limbs, so after the 1,000 limbs are fitted, you say, okay, thank you very much. Just like Sulaiman earlier on when I showed you, when they go home, I don't care what you do at home. But this is different. In this project, each of the beneficiary or their family member will have an app that will track them, and the app will ask them to will ask them to ensure that they do regular reviews. And for this child, for example, we want to see them every 6 months at least. Why? Because he's going to grow very tall. We're going to make sure that his limbs are replaced on a regular basis, and he doesn't have any problems growing up and wearing these prostheses. So which is worse, fellow Rotarians? Which is worse? Is it lower limb or upper limb? So which is worse, when you're younger or when you're older? In one of our projects, and that's what we meant by being hands-on, by being able to go on the ground, in one of our visits to India, I actually witnessed this project. Now, this LN4 project is from the USA. To cut a long story short, anybody anywhere in the world can request for the limb, but you must come from a limb center or a hospital, and this foundation will send the limb to you for free, all the way to your doorstep for free. But you must be accredited by the foundation. It's not very difficult. If you are already doing limbs, fitting limbs the traditional way, you will have qualified this. Now, this boy was fitted with a limb after almost 6-7 years without a limb, and he could use it immediately. And we sort of exported the expertise, exported the technology, or exported exported the benefit to Nigeria, and we've been fitting them non-stop. All right, so what can a limb do? It can give you a job. You can sweep the road with 2 hands. All right, you can ride a bike with your hands. You can become a delivery person. You can do household chores with the prosthetic hands. You can sit down and have a cup of coffee, and you can feel like a normal person. But more importantly, for the young ones, they can handle a mobile phone. All right. Just recently, about 2 weeks ago, we fitted this boy with both arms with artificial LN4 limbs. It was a Zoom event, and the first thing that he wanted to do was to put on a face mask. And he did. He put on a face mask on his own. He says, now I'm protected from COVID-19 because he's independent. Yeah? So what can he do? So another one, this child, after he was fitted, went back home, and we told the family, please record whatever that he's doing first. He's not pressured to do anything. It's up to him to decide what he wants to do. And he chose to eat on his own for the first time. And he told his mom that you don't have to feed me anymore. Right? So these are the projects that Rotary Foundation are doing. It's not the end. We are always evolving, and the fact that you are on the ground, the fact that you are involved in the project, you understand that there are developments available. So this is a 3D printing. This Global Grant project was approved not too long ago with the Rotary Club in Sri Lanka and in Calgary in Canada. And we are dying to go over to see how it works. It pays for 2 printers, it pays for 2 scanners, and for the fitting of 250 limbs. It also pays for the training, and it also pays for all the material that's required to actually manufacture or to actually create the 250 limbs. So Rotary projects, this is where we have done wrong. Rather than bringing our local Singapore dentists to go overseas, we should be thinking about empowering the professionals in that area of concern. Same thing, instead of bringing our own subsidiary staff, we should be empowering the subsidiary staff. It's so much easier to train subsidiary staff than full-fledged professionals, and we should be doing that. And instead of just giving the treatment and say, have a good day, we should be actually educating and giving public health messages and education to the beneficiaries. So, and another reason, our organization also audit our own projects. come back to Nigeria again. So this gentleman is an orthopedic surgeon from Ghana. He flew to Nigeria as a cadre member to audit our project. And the Audit Fellow Rotarian is not a one-day event. It's a 5-day event. It's 3 full days with a template there to speak. And you have to interview the beneficiaries. You have to interview the project sponsors, the cooperating organizations. And if the project's in various locations, you have to visit as many of them as possible. Right? So he flew down on his own expense because he's a Rotarian to audit this project, and he was in Nigeria for 5 days, right? Talking to all the different people. So same thing in this project, again, our education project. So you see a retired principal from Sydney, you see district governor from Bali, and you see project sponsors from Singapore coming together at our own expense as volunteers to audit our own projects, right? And not only that, we bring them to the different places, including the home. And this is in Johor Bahru with a project of, I think it's the Rotary Club Puteri Lagoon on their school classroom project. And the cadre member was from Philippines. I was fortunate to be asked to go to Taiwan to audit this project. The question that I was asked to find out is, why does this project cost $200,000 US? All right, so it's a mobile dental clinic. And I tell you, this is the best mobile dental clinic that I've been in. It beats the Singapore standard anytime. You can't see the back door, but there's an automatic lift that can bring a wheelchair all the way in to the mobile clinic. All right, so this is where we are, and we were discussing and talking to different people. I arrived in the S-Class that you see behind me, but I insisted that I want to leave with the school bus, with the mobile clinic, so that I can follow them to the location and understand the issues that they have and the challenges that they have moving from one location to another. So why do we contribute to Rotary Foundation? We are able to identify the projects, we fund the projects, we run the projects on the ground, we do our own audit and stewardship, everything for a really, really low cost. Why? Because we are volunteers. So where do we get our money from, right? So if you look at this, last year, Rotary Foundation received about 342 million, including the investment returns. You may think that this is a lot of money, but some of the funds are really meant for polio. Some of the funds are really meant for education. There's not very much that we can touch to do the kind of projects I was showing you. We can only do those projects if you contribute to annual fund, right? Annual fund is where the really the cream of the cake is. It allows Rotarians from all over the world to do our projects. So in our district, we have this strategy that we always want to raise awareness first before we raise funds. That's why people like me, I'm here. And some of our other foundation committee members are doing the same with the other clubs, so that together we can all do good in the world. Now, asking for money sometimes brings the question, where does the money goes to? All right. So, but I think more importantly is that the money is for investing in humanity. I think all of us should have an opportunity to be the best that we can be. We will all wear a badge. I have a badge here. All right, and it says Rotary International. All right, so I'm proud of wearing the badge, and every Rotarian, I think, should do its duty to support the foundation. We're not talking the amount here. I'll share with you the fact. 15 to 20% of Rotarians all over the world contribute 85 to 90% of all the annual fund that we collect. That is the truth. But more importantly, the other balanced 80% of Rotarians should also make a contribution. All right, it's not the amount, but it's the commitment. So why do people donate? I mean, if you're the club president, or you're a TRF chair, or you're the governor, how do you decide? What strategies can you use? First, we talk about these hearts over heels, meaning I can show you all the statistics and all the good that we do in terms of numbers, but nothing beats showing a picture. Better still, if you have a picture of yourself who is trying to raise the fund, if you're the club president or TRF chair, or KP Lu, for example, can show with all the beneficiaries of the cataract surgeries, use those photos very strongly, because people will feel committed and trust that they have with you when you are doing these things. Now, giving is something that people are influenced by others. 85% of people give because somebody asked them, and that somebody must be a person of significance. Yes, it can be your favorite Rotarian, but more importantly, you must be in places of power. Means if you're club president, you're TRF chair, you're PDGs, you're a senior member in your club, ask. If you don't ask, how are they going to give? And don't be ashamed of asking, because it's not going to your pocket, it's going to Rotary Foundation. Some people give because of personal experience, right? If you have, I have cousins who had polio. I have classmates who had polio before, and as a dentist, I see patients with polio before, and I always feel that we should try to help whenever we can. So people will give. Some people give for cancer. Some people give for clean water. So find out what their passion is, and you can ask them, and they will contribute. The reason why the Polio Plus Fund is doing very well is because of the matching. But you can also do this matching in your own club. If you get a big donor from a club member, use it as a matching incentive. That's what we do in our club. If you want to raise $10,000, we get 2 or 3 big donors who will give the first 5,000, and we will say, like, if you give, then these people will match, right? So it helps for people to give because mostly people are influenced by others. It also helps if you are nearing the target. If you say you want to raise 100,000, you say we only have raised 5,000 for the time being. People are going to feel very discouraged. They say, oh, it's going to be a long way. But if you say, I need 100,000, I've already reached 75,000, people will tend to give because they think that they are near the target. Remember the polio story? We are this near to end polio. All right, that's what it's trying to achieve. When you are this near, everybody wants to give, right, to complete the job. Now, giving is contagious. People who give will always give, all right? They will always give on annual basis or whenever you ask. So it's nothing wrong to know that people like to give because it is a habit to them. And you can go and Google it. Giving actually makes you healthier, all right? I'm just going to talk about it here. Something that's also very interesting, I don't know whether it happens in your club or not. Sometimes in our club, we raise funds through our club WhatsApp. But please remember, my club has 180 members. So sometimes you can imagine the number of WhatsApp that come. The good thing is that we can raise money very quickly. But the bad thing is that some people will call me up and say, please don't do this, you make others look bad. All right? But this is not true, fellow Rotarians. This is really not true. People who don't give shouldn't feel bad that other people are giving. I mean, that's the truth of the matter. All right? And people will tend to give when they see others give. So it's always good to start and say, Shahul, $100, KP Lu, $200, Philip Chong, $100. Others will see the list and they will put their name to it. All right? Do I have much more? How much more time do I have? Can I please check?
10 more minutes.
10 more minutes, okay. PP Ravi Shankar. PP Ravi Shankar from Bangalore in India created a storm when he became president of the club on 1st July 2018. He announced that he's going to give 1 billion rupees, which is equivalent to 14.7 million US dollars. He made a second bombshell announcement that this is 75% of his total wealth. So Ravi Shankar is not a billionaire, but he decided to give 75% of his wealth. So if you look at your bank account today and you have, $100,000, would you give $75,000 away? So this was the challenge, and this was the thing that people were asking Ravi Shankar. Why do you give your money away? Why are you giving away 75% of your wealth? And Ravi says that when he was growing up, he grew up poor. His dad died when he was young. His mother struggled through all the life, and he had 2 or 3 other siblings as well. And there are times where he had nothing, he had no money, he had nothing to eat, and he would pretend to go to his friend's house to visit them, or he would pretend to say hello to his neighbor next door, and they all know that he wanted some food. He said that nobody turned him down. So Ravi Shankar said that to him, it's not giving away, but it's giving back. Right? So the question now is, do we have to give $1,000 minimum for a global grant project? When you raise funds for your global grant, do you say, I need 10 PHF? Do we need to be a PHF? The answer is no. You can give any amount to the Rotary Foundation. You can give any amount to a global grant project. You can give $365.20 to a global grant project. You can. All right? There is no minimum that you can give. But of course, at the end of the day, you still need to raise that 10,000. At the end of the day, you still need to raise that 5,000, which is your total amount that you need. But every dollar you give, fellow Rotarian, for a project will be matched by Rotary Foundation, will be matched by other clubs, will be matched by other districts. So this is the beauty of it. We don't do our global grant projects and pay 100% of the funding. Anything more than 50%, we are ashamed of ourselves. That means we didn't work hard enough to ask other people. So typical funding in our club project is within 35 to 50%. So it is always better to give than to receive, all right? And you can consider giving any amount to Rotary Foundation. $25 would mean that all of you would be recognized as the Every Rotarian Every Year Club, and $100 means that you'll be recognized as the Paul Harris Fellow Sustaining Member. In our club, for example, quite a number of Rotarians actually mark their birthdays and their anniversaries by doing a giving to Rotary Foundation annual fund. It doesn't have to be a round figure of $1,000. It can be $500. It can be $250. All right, it's marking that present. Some of you may think, why? I mean, what can my $25 do? Let me share with you this picture. I mean, I visited this facility in India. It's a place for displaced children affected by modernization, and there were 10,000 girls in this hall. If you look as far as you can, this is not a Photoshop picture. There are really 10,000 people there, but they're all girls. So I asked the administrator, where are the boys? It's the boys at the other hall, 15,000 of them. And number one need is food. All right, and for $10, you can feed 28 of them. For $50, fellow Rotarians, you can pay for these two eyesights. You see the plaster on top of the eyebrow? Those are the two eyes it's going to be operated on. For $75, with a matching from Rotary Foundation as well as from other clubs, you can put one child to school in Nigeria and in Indonesia. And for $100, all right, you can pay for a limb. And for $1,000 US, the PHF that you're talking about, you can help pay for a pediatric heart surgery. The one on the right is in Shanghai, and the one on the left are the children from Afghanistan who are flown to India for the surgery. This child was born with congenital cataract. She had never seen anything, and the parents were, of course, devastated. But the giving that you see is not paying for the surgery. The impact sometimes go far beyond that. Soon after this picture was taken, the father pulled me aside and said, "Sir, can I take a photo with you?" And I said, "Okay, sure, take a photo." And we had a good time. We took some photos. And before I left, he said, "Sir, do you know why I'm taking this photo?" I said, "Please tell me." He says, "When my daughter grows up, I'm going to show her the picture of the people who paid for her surgery and give her a future." All right, so to us, it's just $500 to pay for the surgery. But for a family like this, it's the future of their child. This was a launch of a limb project in Indonesia, and it was a big event. The press was there, district officers were there, government officers were there. The guy who's holding the mic is a beneficiary of the limb. The two other guys as well, they're all beneficiaries of the limb, our limb project. And the question was asked by a reporter was, "What do you have to say to Rotary?" All right, we were all expecting him to say thank you and gratitude and everything, but he said something that really touched me. He says, "Thank you for giving me back my dignity, because before that I was crawling around the house, I was crawling on the street, but Rotary not only give me a limb, but it gives me back my dignity and help me to get a livelihood." All right, so to us it's the limb, but to them it's human dignity. Just to finish up the story, Sarina was taken up by this orphanage when she was 14 years old. She was born without limbs, no upper limb, no lower limb. And she was given up by her family, and she moved from one foster home to another in the village. She was often found in the streets, and for a girl, she was abused, she was raped, she was whatever you want. And she tried to commit suicide 3 times before she was 14, right? She was taken up by the orphanage, and she suffered a lot of problems with her neck. Can you imagine doing everything with your mouth? And a lot of beneficiaries like her had to be helped with this physiotherapy project. It's a very simple, straightforward project. We provide equipment, and then we train the physiotherapists. I mean, it's very straightforward, and these were the benefits and the impact that we thought that we had. But we were wrong. As part of the program, there was rehabilitation through art therapy. So we got the best art therapist, this gentleman here in the picture, and you can see Sarina in the background actually learning how to paint and keeping her neck straight, all right, to prevent problem. She was banned from doing batik painting because batik painting will make it worse. So she took up regular canvas painting. So in 2017, she presented, or rather when we visited the orphanage, she presented this painting to us and said, please present it to the first women and first Muslim president of the Republic of Singapore, Madam Halimah Yacob. It took us some time, but we managed to present it at one of the present it at the site of one of the events that she was attending. And she was really grateful, and she signed the painting and asked us to raise funds with it and give it back to the orphanage. About a couple of weeks later, the painting was sold, fellow Rotarians, for $20,000 US. So when I called her to tell her, Sarina, you know, $20,000 US will be given to the orphanage, she broke down and cried. She says that never in her life that she felt that she could be useful to anybody. All right. So this is the impact that we have. So fellow Rotarians, please come together with us, help invest in humanity. So in this picture here, the guy in front, the boy in front had no upper limb and no lower limb. The three boys and girls behind are hearing impaired. All right, you can't tell by looking at the pictures, right? They're all so happy and they're so innocent as children. What's going to happen if they grow up and they feel that humanity has not helped them and allow them to be disadvantaged in this world? We should try and give the best for them. So the question, fellow Rotarians, is not so much as why contribute to the Rotary Foundation, but I think more importantly is that we need you to do your part to please serve to change lives. Thank you very much. My name is Shahul Hameed. Thank you very much for giving the opportunity. Thank you.
Thank you, Doctor. That was very, very